Hello, I'm Glenn W. Hunter, and with me today, again, as always, Dr. James George. And James George, a good doctor, he is responsible for Dr. George Excel, Physical Therapy, and Wellness. Dr. George, today we're talking about vestibular disorder. It's a common condition without a common name, but what exactly is this?
Well, vestibular disorder. Thank you, Mr. Glenn Hunter, for having me again. And vestibular disorder, is a vestibular problems of the vestibular apparatus in a year. There are actually, I can show you with the picture here. If you see here, this is the ear, and we have the inner ear. This is the vestibular apparatus. All right, we have the semicircular canals and the saccule. All right, and the utricle here, and we have the eighth cranial nerve, the auditory nerve. So this is called vestibular apparatus. Any problems in this area, we call it, vestibular disorders.
So when we have these disorders, you end up in a situation where you're going to have some rehabilitation. Vestibular rehabilitation is a specific approach to physical therapy, and it's aimed at reducing dizziness, imbalance. But in your practice, what is the typical trigger that a patient needs vestibular rehabilitation?
Yeah, vestibular rehabilitation therapy is a specialized form of therapy intended to alleviate both the primary and secondary problems caused by vestibular disorders. It is an exercise-based program primarily designed to reduce vertigo and dizziness, gaze instability, and imbalance and falls. Let me explain it, all right? When people have vertigo and dizziness, it's used interchangeably, basically dizziness can be people who have low blood pressure, which is causing partial hypotension, all right? It could be because of cardiac problem, we call it cardiac syncope. But vertigo specifically is anything which there could be room spinning, they are not able to fixate their eyes on an object. They feel like they are losing their balance. Whatever the object they are looking at is moving. So this is specifically vertigo, all right? So this is caused either by, as I showed you, the problem in the vestibular apparatus, or it could be in the brain as well, or the central nervous system pathways coming from the brain to the inner ear, or the nerves which are supplying the sensory sensation, or we call it the vestibular cochlear nerve. It starts from the inner ear and supplied to the brain. So any of these issues, any problem in these circuits, or any problem in the brain or the inner ear could cause vestibular disorders.
Wow, understood. So what are some of the common exercises and techniques that have proven to be effective in typical cases involving vestibular rehabilitation therapy?
So again, we look at somebody who has who comes with a referral for a vestibular disorder. We look at whether it is the crystals in the inner ear which is causing them to have this issue. We call it, the term is called BPPV, benign paroxysmal positional vertigo. We have maneuvers we do. We call it Halpert-Dix testing and roll testing. We do this testing to find out whether it is the crystals which is causing the vertigo, or the distorted crystals, or it could be, we call it a term called vestibular hypofunction. When somebody is basically the inner ear, there are teeny hair cells in the inner ear. They are not viable. They are kind of nerve endings. They send signal to the brain. From here, all this area, they have teeny hair cells in there. They send signal to the brain through these nerves. When these hair cells are not viable, it causes hypofunction. So that causes the people to have imbalance and vertigo. Now we have specific exercises to help heal patients with these issues, and then those exercises basically help improve the patient's ability to to look at objects. We call it gaze stability. All right. Now, there are some issues which could be coming from the brain, so we do have specific tests for that. And we would rather, if that is coming from the brain, we would rather refer the patient to a neurologist. And if it is we suspect like if the patient is not getting better with exercise, there is a diagnosis called Meniere's disease, which is the filling up of fluids in the inner ear, which again we refer to an ENT for management by the ENT. So, there are benign tumors called schwannoma. So that also requires a referral to an ENT, and to be so. When we give therapy and we see the patients are not getting better, and they are producing symptoms which could not be treated with this exercise program, we refer out to the respective physician. So it's an ongoing evaluation we perform while the patient is here with us, while the patient is doing exercises, and evaluating and assessing whether they are getting better with the exercise. If they are not, we refer out to the specialist. Yes.
Okay. All the same, I mean, you're equipped to bring different remedies to the problem, to solve the particular problem. So in another part of your practice, how does homeopathy play into successful treatment for vestibular disorders?
Yes, we have discussed before, homeopathy can help heal mental and emotional health issues. So anybody who has vestibular disorders, and it is causing them a lot of mental and emotional problems like anxiety, panic attacks, homeopathy can be a good adjunct to help them help heal those mental and emotional problems. And many people who have grief, which has not been dealt with, that could cause those patients to have actually panic attacks and vertigo as well. So homeopathy can help heal that. And again, we also refer to a psychologist to help these patients as well.
Okay. So from another perspective, what are some of the underlying diseases that contribute to vestibular rehabilitation disorders?
Yes, as I mentioned here, any problem in the inner ear, it could be fluid building up, which is Meniere's disease. It could be, a schwannoma, a benign tumor, or even a stroke. People who have had stroke, from the pathways, the central nervous system pathways, which supply to the inner ear. Those pathways, when there is a stroke, that could actually cause people to have vertigo. And again, or even any issues in the peripheral nerve, the auditory nerve, the eighth cranial nerve, that could cause somebody to have vertigo. So performing an evaluation and finding out what is causing it, and if we cannot treat it, if it involves the central nervous system, we refer to a neurologist. All right. So there are many other diagnoses which are involved, and which could cause vestibular disorders. And anything which involves the brain or inner ear, the neurologists and the ENT are the specialists, and we work together to help the patient.
Okay. Another form of helping patients comes down to talk therapy, which is also known as counseling. Talk therapy has been known to offer some remedies to vestibular disorders. In your practice, how does counseling actually work, and when would you use it?
Yeah, as I said, many patients who end up in having vertigo, they have a lot of mental and emotional problems because they are scared. They don't know what's going on, and they have dizziness, vertigo. They try to look at things and they feel like the objects are moving. So providing them counseling to help them to understand what exactly is going on, and to reassure them that exercises can help. and also referring them to a psychologist. That's also best option, one of the options we can to help these patients.
Okay. You know, you have a lot of tools that you've discussed that you can use to actually attack this particular problem. And you've also articulated that some of the consequences of vestibular disorder can actually be long lasting if not treated. People who are going down this path, how do they find you?
Well, we can help manage vestibular disorders with exercises, and if there, especially if, as I said, vestibular hypofunction. If there is crystals in the inner ear, we do the Epley's maneuver to help treat that. And also, when we cannot help heal the patients, we refer out to neurologists or an ENT. But you can find us at excelrehabandwellness.com. And also, you can Google us at Excel Physical Therapy and Wellness. The best number to reach us is 909-792-5050. Thank you.
Indeed. I am Glenn W. Hunter. With me is Dr. James George. Once again, he is working hard in the Inland Empire and beyond to make sure that he is serving patients, helping them with their health, and living more fulfilling lives. Dr. George, thank you for the work you do, and thank you for sharing this very valuable information with us again.
Thank you.